Good afternoon, and welcome to the Diversity in Medicine Lecture Series. There is no commercial support for today's program. The panelists and planners have disclosed no relevant financial relationships with any commercial interests. If you have a question for the panelists, please hold until the Q&A segment at the end of the talk. And if you're attending virtually, you may enter your question in the chat, and we will ask for you. A link to the event survey will be shared at the end of the program. It is my pleasure to introduce our moderator for today, Dr. Janeane Walker. Dr. Walker is the Director of Faculty Development and Educational Outcomes for the Graduate Medical Education Program at Northeast Georgia Medical Center and the Director of Continuing Medical Education for Northeast Georgia Health System. In her role, she spearheads the development of educational programs designed to cultivate and sustain a culture of teaching excellence among faculty. Dr. Walker's influence extends beyond her administrative roles, for she practiced as a pediatric critical care nurse for over 15 years. She has spoken nationally on various subjects, including diversity, equity, and inclusion, family presence during resuscitation, congenital heart disease, and traumatic brain injury. Her commitment to diversity and inclusion is further evidenced by her work as a project coach for a grant collaboration program focusing on diversity, healthcare equity, and inclusion for the Alliance for Academic Internal Medicine. Her research interests revolve around health equity, patient safety, and the patient care experience. Please join me in welcoming Dr. Walker and the panel.
Well, good afternoon, everyone. Thank you, Jennifer, for that introduction. I also want to welcome you all to our fourth session surrounding transgender health. I'm actually looking forward to our panel discussion today, but I want to take the opportunity to recap our series. In January, we heard from Dr. Massey, who gave us an introduction to transgender and gender diversity experiences. He focused in on foundational information for transgender health. He looked at terms, etiquette, resources, and actually how to support our transgender patients. In the month of April, we heard from our very own Dr. Armstrong, who's on our panel today, where he gave us a historical presentation on the discriminatory treatment of LGBTQ plus community members and creating safe spaces in clinical care. In August, we heard from Dr. Breland, who spoke about the psychosocial complexity of gender-expansive youth, and he focused on outcomes and best practices. So if you didn't have an opportunity to hear our series, it's on our YouTube channel that I have now put on the screen. So if you haven't heard any of the presentations, feel free to subscribe to our channel as NGHS CME. This year, we also did a DEI podcast related to gender-affirming care that was led out by Dr. Leslie David and Dr. Jody Bahnmiller as well. So for today, I would like to, and what we are going to do is facilitate really a reflective discussion on implementing learned strategies from our gender-affirming series. So I would like to have our panelists take this time to really introduce themselves, talk about their current roles, their specialization, but most importantly, really talk about how their journey has intersected with DEI efforts. So we'll start with Jacob.
Good morning, everybody. My name is Jacob Lunsford. My day job here at the hospital system is Coordinator for Occupational Medicine and Wellness. A part of my role, or a new one for this year, has been as the co-chair for the NGHS DE&I Council. For those that aren't familiar with DE&I, that's diversity, equity, and inclusion. It's been a privilege to serve that council, see the growth of that council over this past year. Talking about how my professional journey has intersected with DE&I efforts, to me, it kind of felt like a natural evolution. It was bound to intersect at some point as an open gay man in a very conservative area, and also as a healthcare professional. It drove home to me how important it was for us to build inclusive environments within our clinics, within our practices. And I really struggled for a while especially as I entered the healthcare field, whether or not, how open did I want to be? How safe was I? How safe were the environments that I was put in? So it's multifactorial as far as patients, our staff and employees are concerned, our providers. But to me, it was very much a natural progression, just from where I grew up to where I am now. So
Thank you.
I'll leave that on. Hey, everyone. Thanks for coming. My name is Kyle Armstrong. I have a lot of hats here. I'm a psychiatrist, I think is the biggest hat. I'm also a medical director of our inpatient facilities. I do outpatient psychiatry. I also work in our emergency department. So I work in mental health in many a different way. And in all of those settings, this population is present. LGBT people are there and showing up at our door. And that is always my treatment strategies. We treat the people who show up. And I think it's really important that we have some understanding of how to treat this patient population. And just my personal connection, I talked a little bit about same sort of thing, creating safe spaces for LGBT folks in an area that you might not expect there to be safe spaces. And I think it matters a lot to have these kinds of sessions, to have even partnerships with family practice and some other specialties and mental health, to raise that up to the top, because being transgender doesn't mean being dysphoric, and there are ways we can treat and manage those things, and it often requires interdisciplinary teams. So it's really a big passion to work together and create partnerships, and that's what I hope to do, and also educate folks in my field in psychiatry about best practices and how to manage this population. We work with residents and other trainees as well. So that's where my passion comes from. And hopefully we can answer some questions regarding mental health and how all of this intersects.
Thank you.
Hello, I am Jody Bahnmiller. My pronouns are she, her. And I had a colleague ask me if I would be interested in starting a gender clinic. And I went, I don't know what a gender clinic is. So I had to do some research to find out what is a gender clinic. And once I realized this is taking care of transgender folks and starting them on their journey for their transition, I thought, I can do this. I'm a family medicine physician. What better physician to do this other than family medicine, because we see children, adults, elders. So I thought that was a good spot for me. When I started looking into the transgender care, I also broadened my search into the LGBTQ plus community and realized here within our Northeast Georgia health system, we need to offer safe spaces, as Dr. Armstrong said, to our LGBTQ folks so that we can treat not only gender dysphoria or gender incongruence, but we can also take care of their blood pressure, their heart disease, their diabetes. They're not welcome in a lot of offices. They don't feel safe going to a lot of health providers. So I thought we can give them a safe space and provide the care that they need and deserve.
Thank you. So my first question is actually going to go to you, Dr. Bahnmiller. What inspired you to start the Gender Affirming Care series? It's a very interesting story. I know I'm privy to it, but I want our audience to be privy to it as well. What inspired you?
So I was working with the GME Family Medicine Residency Program, and that meant that I had to do inpatient medicine. So one day on inpatient, I went down to the cafeteria to get my lunch, and I was walking back to the attending office to eat my lunch. Unfortunately, I was walking behind two NGMC employees, and they were talking about they, them pronouns, and they went on, and they were very loud about it. And I didn't know what to do. Do I go approach them and say that they, them pronouns and pronouns in general are very important to people, or do I let it go? And I was torn. I didn't know what to do. So at that moment, I decided, okay, I'm not going to go approach them. I don't think this is the appropriate place, but I decided I want to try to educate our health system, not only on pronouns, but other factors of care for the LGBTQ plus community.
Thank you for sharing that. And I think when I heard her say that in the meeting, I was like, you know what, let me send her an email and see what we can do from a continuing medical education perspective. And here we are into our fourth series here. So from your perspective also, Dr. Bahnmiller, just as a follow-up, what are the most significant challenges transgender patients face in assessing accessing equitable healthcare, and how can we work to overcome these barriers within our hospital system and the broader healthcare landscape? So that is a loaded question, but it's really more from your perspective.
I think the number one problem is discrimination and fear of going to the physician. Discomfort of going into the physician's office and which bathroom do I use? Going into the hospital, which bathroom do I use? Are they going to use the right pronouns? Are they going to use my preferred name, or are they going to dead name me? If I'm not out, are they going to accidentally out me? So I think the discrimination and the fear of going to a healthcare system is a big barrier. Insurance. A lot of transgender care is not covered by insurance. So that's another big barrier. They have to go out and pay out of pocket for services. So that's a big barrier. You also have the mental health and the social support. They don't have the mental health support that they need. Again, they're afraid to go to institutions. They're afraid to go to the healthcare providers. Misgendering, and like I said, and lack of affirming facilities. Those are some big barriers right there. So things we could do is, create safe spaces again, bathrooms that are non-gendered. As far as discrimination, educating our staff, everybody, environmental services, plant ops, physicians, nurses, education. Those are some of the things that we can do. Insurance, working together as a group and talking to the insurance carriers about how important the care is. Mental health, Dr. Armstrong and I have kind of partnered, and we're working on that aspect here in our health system.
Excellent. Jacob, I have a question for you. As our DEI Council Chair, what strategies has the Council implemented to ensure that DEI principles are incorporated into everyday healthcare practices? And how do you measure the success of these initiatives that has been going on?
So if you want to pick out one key word, I feel like Dr. Bahnmiller touched on quite a bit, and that's education. And I think at the core of our focus on strategy with the council is education. It's how do we get these types of conversations, these types of topics out in front of our employees, staff, medical staff. And education comes down to, I really, in my heart of hearts, feel that a lot of our staff aren't purposefully trying to hurt the greater transgender community. They're not trying to ignore the sensitivities one must have when dealing with certain sectors of our population. The thing is education is key. Bringing to light what dead naming is, what it means to use pronouns, why it's important. Because a lot of this comes down to lived experience. I think a lot of people just don't, take these things into consideration in their day-to-day lives, and putting the vernacular out there, building the tools and the vocabulary for them to actually put into place when dealing with their patients. And that goes far beyond just, I feel like, transgender care. Now, outside of education, we have other strategies as far as things like we just recently completed the Summit on Diversity, Equity, and Inclusion. One can say that is educational, but also advocacy, bringing community organizations in and letting people find out a way to get plugged in, learn more. And one of our chief ways of keeping up with the success and measuring success is we have a dedicated subcommittee for strategic planning, and they have a scorecard. It's an internal metric-driven scorecard where we can look back on all the things that we have done over the year and quantify its success, actually look and see where our traction was, what people were paying attention to, and for next year where we can go and hit a little harder. And I will say one of the things that we have noticed is within our health system, unfortunately, LGBTQIA plus discrimination, or the question, is still prevalent and something that we are actively trying to tackle.
Thank you. And the council's been here for 2 years,
2
pretty
years,
much, as an
absolutely,
organization.
yes.
Excellent work. So, Dr. Armstrong, from a mental health perspective, what are the most effective ways healthcare providers can address discrimination and healthcare disparities in this patient care population?
Well, and I think the biggest word is stigma. And so having events like these, having the fair where we're talking about a lot of these issues and just being visible, I think removes some of the stigma. Education, that's a huge part of what we do on those one-on-one patient interactions. When I'm in my outpatient clinic or any setting really, and validating someone's lived experiences, whether you understand what that lived experience is or not. I don't understand all of these things. And I also get held up on where we're going and kind of how things evolve. But having an open mind, I really helps people's mental health. I think that dysphoria, like I said, doesn't have to be something that people experience. It's not a necessity for care from a mental health perspective. It's something that as a society and as a group of people, we persist through stigma. So it's talking and learning for ourselves and learning every day and just having an open mind, I think helps people improve their mental health in that setting. And that's something I don't have to do as a psychiatrist. I think that's something we can do in whatever position and whatever role we're at. And it's validating language and understanding what we're really here to do is help people feel better and improve the quality of their lives. And really, it's about creating safe space and validating space and places where people can heal. And that's what a hospital is for. That's what a clinic is for. And so that's where I think mental health and behavioral health just pervades everything that we do.
Dr. Bahnmiller, what advice would you give to other healthcare providers looking to integrate gender-affirming care into their practice, especially those who may not have specialized training?
Self-education, which is what I did. So learning terminology, which is an ever-changing world. It changes all the time. It's hard to keep up. So keep yourself educated. Self-education is very important. The terminology is very important. You want to make sure that you get that right. Create a welcoming environment. Don't just have magazines laying around that just have a man, a woman, and a child. Maybe have magazines that have 2 women and a child or 2 men and a child. So a welcoming environment is important. I think those are 2 very important things to start with. You really need to learn some of the terminology. If you make a mistake, apologize and move on. When I was first starting, I had a patient, and through the whole HPI, I just reviewed his lab results with him. So the computer screen was turned to him so he could see. And I typed my whole history of present illness up there. Unfortunately, I misgendered him through the whole HPI, and it was probably about this long. And I thought, oh my gosh, what did I just do? I turned to him and I said, I am so sorry. Let me correct this. So I just corrected the pronouns in my typing there. And he was very appreciative, and we moved on. We do make mistakes. When you make a mistake, apologize and move on.
So now for Dr. Bahnmiller, this is also for you. What advice would you give to healthcare professionals who are just starting to integrate it into, gender affirming care into their practices, especially in terms of respectful communication and culturally competent care? Any other advice you would now give someone who's, they haven't had formal training, you just addressed that, but now this is another group of people who really just want to start integrating gender-affirming care. Any advice that you would give on that scope?
I would take a look at your intake forms. When you have a new patient coming in, again, I went through our intake forms and I changed our intake forms. We had a picture of a man, a woman, and a child. I changed it to just a group of people, random people. Intake forms, make sure you have a place in there for pronouns, gender identity, sexual orientation. Don't just make it male, female on your intake forms. Put other or put non-binary, put transgender, give people options. Don't just give them, you're either male or you're female. Give them options. Collect your sexual orientation and gender identity information. That's important to know when you're treating patients. So intake forms are important. The other thing, again, welcoming environment. Be patient with yourself. I learned a lot from my patients when I started this. I didn't know a lot about binders or anything else, and I had to do a lot of Google searches to teach myself. I had to ask the patients the questions myself. Now that I've educated myself better, patients really appreciate the fact that I have a list of resources for them because I've gathered resources. That's another recommendation. Make sure you know who safe people are to send your patients to. I know who to send them to. I know who to avoid. Make a list of safe spaces to send your patients to. Apologize and move on if you make a mistake. Welcoming environment, and just keep educating yourself.
Thank you. Dr. Armstrong, you are part of our residency program. So culturally competent care, including the use of inclusive language, plays a key role in patient outcomes. How do you approach teaching or modeling these skills for your colleagues and for our residents here?
So, teaching diversity, that's a hard thing to do. I think you have to be inclusive. I think you have to do a lot of self-education, like you're talking about. And then also having a diverse residency. I like to think we have a great residency with a lot of diverse voices who can share, because it is a learning experience. And that's a great thing about having residents, is we get to share and learn from one another. And I realize I'm a little older nowadays. We go over songs and music, and they teach me a lot about Gen Z and kind of how things have evolved for my era. But having that open communication and those through lines, and that's where you model that behavior, where you create openness to make mistakes, and openness to also ask for forgiveness and be humble in the face of medicine, which is large and complex and changing every day, and how people are and what words they use changes every day. I remember I went to this conference, and it was all about pronoun when I was in college. Let's not talk about how many years ago, but where we talked about this, and it was an evolving conversation then, but it's changed so much since I even went to that conference, where we talked about those things. So it's really learning and just asking questions, and education doesn't stop at that one thing where we researched back in residency. It continues throughout our career, and things are going to change. And that's just the nature of living in this world. And so that's what we talk about. And to be honest, I let them teach me a lot of new things and ways to be better. And I think having that humility is something that they can bring with them in their careers, so they can evolve and advance with the times to be sensitive, nurturing providers that can really have and demonstrate how to provide that safe space.
So, Jacob, this next question is for you. How can the Diversity Council ensure inclusive care practices, such as using preferred names and pronouns, consistently implemented across our departments and patient touch points? And there's a follow-up question to that. Can you share any specific changes or policies that have been implemented as a result of our DEI Council here at the hospital?
So I think one thing with how can we ensure is, I think, two things: education and then turnaround and support. One thing that we have done over the last year that I can remember is we partnered with, I believe Dr. Jody Bahnmiller was a part of it. We helped develop the transgender module that you all probably saw come across your workday. And then several of our members audited that, just for clarification and things. So I think at the heart of it, it comes down to continuing the conversation, making sure the conversation surrounding transgender care, inclusive language, and affirming care is continued, that baton is passed from year to year. And I believe that supporting and getting out, having individuals round within our organization, our clinics, and really being on the ground to support our providers, our nursing and care staff, our front staff, to answer those questions. Because at the end of the day, like I said, I really do not feel that people are intentional in their misuse or disuse of pronouns. I think a lot of it comes down to it just being built into their language, supporting them and letting them know again, it's okay to make the mistakes. It's about how you recover the mistakes. And then one of the other things, as far as an action item that we have produced over the year from the DE&I Council, one of the ones most popular among Connect was going to be the wing person change, and the change to that vernacular usage with wingman. So we had a lot of comments, whether you all ever saw any of them. We had a lot of good, we had some bad. But at the end of the day, it all comes down to we're here to support each other. We're here to support an inclusive environment. And at the end of the day, that recommendation came down to making sure that all felt welcome. No one was ostracized by the use of a term that, is part of our safety toolkit. So that was one of the big changes that we have been able to make this year.
Excellent. And thanks for sharing that. So this question is open for the entire panel. So it can be a free for all, whoever wants to go first, whoever grabs the mic. But what role do you believe allyship within the organization plays in advancing transgender health and creating more inclusive healthcare environment? That role of allyship. What are your thoughts behind that?
I'm an ally, and I try to be a very good ally, a very strong advocate. Being an ally, use your channels and your connections to educate others about why pronouns are important. Be an ally, advocate, talk to leadership, educate people. Being an ally is welcoming to others. My name badge, I have a little rainbow on my name badge. That is a big symbol for the LGBTQIA plus community, that I am a safe person. Asking pronouns, being an ally like that. There are so many different things allies can do. Allies can advocate for their friends and LGBTQIA plus community on the legislative side. Okay. I've gone down to the Capitol and tried to advocate for my patients down at the Capitol. There's so many different roles an ally can play. Sometimes being an ally, just ask your friend, how are you today? Are you okay? Is there anything I can do to help you? Simple questions, that's being an ally. There's many different roles an ally can play.
I just want to add that we're all allies to transgender community, but as a gay man, sometimes allies can go into spaces that we can't. So advocating before, for your colleagues, your medicine colleagues, like, hey, that wasn't a great thing to say. It's very meaningful because it just matters, and it allows people to express themselves in a different way and to kind of work out the problems without that person in front of you. So you're not worried about offending people, and to have some tough conversations. And maybe you get to that point. But it does matter that people are out there supporting the cause, and who understand and who've taken the time to understand what those issues are, to understand pronouns, and to understand that the language is evolving and changing, and that it matters to have a sensitive environment. It's always powerful. And some of the people who've made the most difference in my life and who've made me feel safe and more confidence in my personhood have been allies. I personally thank folks for that. And it's been really meaningful in my life. And most of our physicians are going to be allies. That's just the nature of it, or nurses or other staff. But by being an ally, you can do so much to support a system and create an environment where people can grow and flourish. So thank you for that personally, but also, I hope I can be that for transgender folks.
It made me think, when you're just talking about that, allies are very strong supporters and very good at writing policies. So institutional policies, legislative policies, be an ally and get involved writing policies, whether it's at your institution, at your clinic, or wherever. Write a policy to protect the LGBTQIA plus community. So I just wrote one myself.
Thank you. I think the policy committee is meeting right now at this hour. So I don't know if it's part of the policy that we're going to have. It's not here. Oh, okay. This is also an open-ended question to anyone on the panel. Can you share any specific success stories or moments where gender-affirming care made a significant impact on a patient's well-being or health outcomes? And I'm trying to think, when you did your presentation, Dr. Armstrong, you had another person come and speak, and they shared an experience with a patient encounter. So I don't know if you want to share that experience, or if there's another story that you can think of, anyone really related to where gender affirming care made a significant impact on the patient's well-being or just their experience here.
Sure. That was Rashay. So shout out to Rashay if she's listening. But she works in our emergency department. And I think by having these conversations, another ally, but having an open conversation, being sensitive just to pronouns and affirming and validating to that experience from what she was saying really helped us engage and get more information, because people are very guarded when they first come in. They don't know what they're walking into. It's happened to me many a times. Even, if you're that patient walking in and you don't know, but you've seen Dr. Bahnmiller, and Dr. Bahnmiller is like, oh, Dr. Armstrong's going to be fine. He's a great doctor. He's going to provide a safe space. It allows us to get to the point. What are we trying to fix here? Or we need to work on your depression or anxiety. We've had a couple patients that we share, I think that we've really been able to help. While that wasn't even the main issue, I don't think, but being able to get over that, I guess, or through that and talk about that quickly and provide that safe space so we could address the underlying anxiety or whatever, really allowed us to have some progress. So I think that, and do better and engage in therapy and feel like that they can make appointments. One of the things I think we struggle with is getting people to even come to therapy appointments and engage in care. And so I'm just thinking of our one patient who's showing up regularly and actually engaging in therapy and doing those things that are going to help them do so much better in life. And I'm really hopeful that for this young person, and I really felt like that was a good partnership, and we're making some progress. But all those levels of care have been addressed. So I mean, that's the goal, and it feels really good.
I can think of two patients right off the top of my head. So I have two patients that didn't want to leave the house, didn't want to go anywhere. What season is it right now? It's fall. What started right now? College. What did my two patients do after starting gender-affirming hormone therapy? They're both enrolled in college. And so far, I've talked to both of them, and they are doing great in college. So being affirming, being inclusive, you can make a difference in somebody's life. These two patients that I'm particularly thinking of, they didn't want to leave the house. They played video games. That's all they ever did, was sit and stare at a screen. Put them on the gender-affirming hormone therapy, and now they're out. They're being productive members of society. They're going to college, and I am so proud of them.
Thank you for sharing those stories. What resources do you recommend for healthcare providers? You're talking about, go get education, educate yourself. Are there specific resources that providers can use to kind of seek more understanding and implement anything related to gender-affirming care?
There are several different organizations out there that have information for gender-affirming hormone therapy, or just education in general if you want to educate yourself more about transgender care. The AAFP, which is the American Academy of Family Physicians, actually has information about transgender care. WPATH, which stands for World Professional Association of Transgender Health, is a world of knowledge. That's where I got my training from. I'm now a member with them. The Pediatric Association has information. Endocrine Society has information. Fenway Clinic has information. There's a wealth of knowledge out there. Just be careful that when you look, you're going to a reputable website.
Go ahead, Dr. Armstrong. You can say something.
Specific to mental health care, I think there's a few organizations just that can provide information and support and connection. I think, and it's hard in our local community in Gainesville, but I know PFLAG exists. It's a great organization to get those interpersonal connections, because I do find in transgender communities, it's all a lot of shared information between people. So because it's kind of undercover and you don't know, but this doctor's really good, But those are great. That's a great environment to start sharing those informations, or even local school groups. I think the National Alliance on Mental Illness has some great resources that you can use for mental health care. Trevor Project. There's a bunch of great organizations out there that are specific to mental health care too. But just understanding that sometimes it happens under the surface, and it happens at community organizations. And PFLAG is probably the best thing we have in Gainesville. And then, of course, there's the community center. And although Atlanta doesn't actually have one, but when I was in Tulsa, we had a great community center. But places like that and environments like that are oftentimes the best places to find information. And I try to really encourage the folks that we see together, hey, you need to go talk with people who are like you. And so you can figure it out and see what are the great resources. Because sometimes I don't know. And sometimes without Rainbow Collective, there's a lot of great stuff out there. So anyways, I just wanted to throw that out there too.
Jacob?
So speaking of PFLAG, so I'm lucky enough to serve on their board for our local chapter. And I will back that up and say it's a wonderful organization, and it is a wealth of knowledge. And I feel like it is a home for those of us in the community in the LGBTQ plus community, but also those that are, allies or trying to become a better ally, for parents who are maybe struggling with, a child coming out, whether it be gay, lesbian, transgender, whatever have you. But I do want to push that point as we welcome all, because we try to make it as inclusive as possible. We try to bring in people that will share their lived experience, and it is a wealth of knowledge. So please check us out, because it would be a good resource.
Thank you. Before we open up questions to the audience and anyone that's online, Dr. Armstrong, we've discussed the importance of creating safe and inclusive environments in healthcare settings. What are some of the most impactful strategies you've seen implemented to foster safe spaces, especially those seeking gender-affirming care?
I think the most effective strategies to create safe spaces, we've already touched on a lot of it, is including language, little things, little signals, like the little safe space thing, or the HR, if you know, the Human Rights Campaign, the little blue and yellow. It's a little less obvious even than the rainbow, if that's something you're more comfortable wearing, or just having a little display in the office, and then working on policy and language in those texts. Those things, when you're part of the community, you're used to speaking sometimes in those types of words. So you're not like, okay, this is a place where I know I'm going to be affirmed, and this is a place where I can talk honestly about these kinds of things. And that leads to better care. So it's just a lot of little pieces of language, and then focusing on pronouns, and like even in email tags, like having that is a kind of a signal that, we can talk about this if you want to. And if you don't, we don't have to, but it allows that opportunity to happen. So I think that's how you start creating a safe space. And then just watching your language, and then doing all those things we've already talked about, and being open to changing your language, and apologizing quickly, and addressing our problems, and being humble in the face of everything that we do. And that's a mentality. It's hard to effectively teach that, except by just reviewing that and revisiting those things frequently. And that's how I help. Hopefully, I'm a better provider of a safe space for folks, and hopefully helping people get better and feel better.
Right.
So, but it's in the little details.
Thank you. Dr. Bahnmiller, healthcare institutions can often be slow to change. So what steps do you believe hospitals and clinics must take to build a sustainable culture of inclusivity?
I think role modeling. It needs to start with leadership up top, and no tolerance policies. role modeling with the top, if they are leaders that are allies and they show support. If somebody uses a wrong pronoun, they can correct it. In my case, when I was walking down the hall with my lunch, I still have second guesses, should I have addressed them or not? But I think as a leadership, an administrator, I would hope that they would have tapped him on the shoulder and pulled him aside and said, we don't, let's go talk. When the wingman was changed to wing person, I think that was good. The negative comments were addressed. So addressing them and having a no tolerance policy and educating, I think leadership, it needs to start there is where it needs to start and let it trickle down from there.
Thank you. We'll be closing out soon, but I want to specifically talk a little bit about the gender clinic. I know we've had some of our residents who have participated in the clinic, but what types of gender affirming medical care does the clinic provide in terms of hormone therapy? Kind of just walk us through it. People who are not familiar with it, tell us more about the services provided.
Okay, so I do gender affirming hormone therapy, which means I will start people on estradiol or testosterone or spironolactone according to what they wish. What do they want? I have consent forms and I go over that in detail. I had 2 new patients today. I have a medical student with me today, and I was going over every single thing in detail. These are changes that are permanent. These changes will not go away. These changes are things that will go back to where you're at now. I'm very, very specific about what I'm doing. I want to make sure there's no regret. Regret is a very low statistic. It's less than 1%. I don't want to be part of that 1%. I want to make sure my patients are happy and they're making the right choices. So not only do I do gender affirming hormone therapy, but like I said, I also take care of their high blood pressure or whatever else they need, because I'm family medicine, so I can do it all. But yeah, gender affirming hormone therapy is very important to patients. One of my patients this morning who was new, she just big hug this morning. She was so nervous. She was so scared I wouldn't start hormone therapy for her. And I felt awful for her. She'd been struggling for years, married a person and miserable with the marriage, wants to get out of the marriage, and she and her partner know that. And it was just heartbreaking listening to her. And when I said, okay, let's go ahead and do this. And she's like, can I do it today? I'm like, yes, we can do it today. She almost started crying. That's why I had to give her a big hug. So it's important to our transgender community. Their gender affirming hormone therapy is very important to them, and it is life-changing for them.
I want to thank you all for sharing your stories, your experiences, and I'll open it up to the floor to see if there's any questions, specifically with anyone in our audience on questions that you might have. And then we'll also look to see if there's any questions online before I ask my closing question to Dr. Bahnmiller. I see a hand that's up right here in the front, and the microphone is coming to you, so anyone that's online will be able to hear it.
My question's for Dr. Bahnmiller. I'm wondering, thinking 2 years ago, the situation coming back from the cafeteria with your lunch, if that happened today, what do you think you would do? And what advice would you give to other allies who can address some of those things that are in their regular lives?
When that happened, what spurred me to do our modules on Workday, that's what started all that. That's what started my passion for getting those modules on Workday. I was so upset, and I thought, well, even if I tap these 2 people on the shoulder and try to educate them, that's only 2 people. I wanted to reach a bigger space. So that's why I went ahead and collaborated, and we got those Workday modules out to try to stress to people how important pronouns really are. Education, education, education. If it were to happen again today, I would most likely catch up with them and tap them on the shoulder and say, can we step aside and have a little conversation, please? And I would try to educate them myself.
And I just have a question in our Epic system. Did you guys do any changes in Epic so our clinical staff can know about that?
So in Epic on the storyboard, there is a place that you can do sexual orientation and gender identity. And they've got all kinds of information on there. If you see an I with a circle, definitely click on that. That's kind of a cue to look at their pronouns. Preferred names on Epic are very important. So the names that are in parentheses, use that name, because if you're talking to a transgender person and you use the name that's big, bold, and not in parentheses, you just dead named them, which means you used the wrong name and it's really upsetting to them. So use names that are in parentheses. Use the little I with a circle, click on it before you go into the room and say, okay, you use they, them pronouns. That way, when you do your history of present illness, you can use the right pronouns. So Epic does have a lot of information in there.
Thank you. And you worked on that. Was it a committee who worked on the Epic build?
I actually had nothing to do with it.
Okay, so we will just give a shout out to our IT team. Yes, I see a hand. Yes, it looks like a question online.
Yes, we have a couple of questions online. First question, as you mentioned, the hesitancy to obtain health care in the queer community starts prior to even stepping into a healthcare facility. In what ways have you seen NGMC publicly display the support of the community, either through outreach, advertising, or signage?
That's an excellent question. Just go ahead and repeat the question one more time, because I want to make sure we heard everything that was asked.
I know
it seemed like there were many things in there.
Yes. As you mentioned, the hesitancy to obtain health care in the queer community starts prior to even stepping into a healthcare facility. In what ways have you seen NGMC publicly display the support of the community, either through outreach, advertising, or signage?
Somewhat of a loaded question. Do my best to answer it. I say we have a long road ahead of us. To my knowledge, and please keep me honest, I don't think we have done anything. And I think that is going to be a joint effort from leadership to the DE&I Council to our physician DE&I task force. But as of right now, I don't think we've ever explicitly done anything.
And I'll add to that, sometimes you have to start in-house first, do the education and in-house, and then you share the larger once we're all in this collective road moving in the same direction. So I truly believe in that first. Let's educate the house first, and then we move outward together. I think, Dr. Bahnmiller, I don't know if you want to add to that.
As of right now, I have been trying to work with others and trying to get education inside the health system. And then we can make sure it's a safe space before we try to reach too large out in the community. Right now, it's word of mouth as to providers that are inclusive and affirming. So right now, it's basically word of mouth, and we do have a long road ahead of us, and I think we can do it.
Thank you. There's another question online. Yes.
Thank you. There are a few more.
Okay.
Do you anticipate the organization would ever publicly support a Pride event?
I would like to say I hope so, but again, that's down in the future. We've got a lot of work to do inside before we start reaching outside.
So last year, the council had a guest speaker from a very well-known medical institution here in the South, and they have a very large DE&I program. And unfortunately, when we asked the speaker, what was the most difficult part of your job? What was the most difficult point of contention with building your program? And simply put, the LGBTQIA community and figuring out how to support and garner support. So, I pray and I hope that we see that support out of the health system going forward. I think we will. I think it's all about changing the narrative. It's about the internal education before we push the external communication. So I really hope.
Okay, thank you. And just two more questions. Mm-hmm. This next question, I believe that you touched on already, but I'll go ahead and read it. Do you anticipate the organization making radical changes or displays to support the LGBT community, or are small changes and subtle signs the ongoing plan?
Well, I won't speak for the main leadership of the hospital, but I think it's important that you take small incremental steps moving forward, because sometimes if you go too fast, then you miss all of the lessons that can be learned along the way. So I think I like to go slow to go fast. But I'm not speaking for the organization, but I think that is a methodical approach to go about if you want to enact any type of change.
I would go so far as to say a simple interaction done well is as radical as posting something supporting the greater community on Facebook by this organization. And I think that's why we keep going back to educational endeavors here within our NGHS community, because sometimes those incremental changes mean just as much as a billboard in support.
Thank you for that. And then final question. What limitations do you think prevent the organization from loud and proud support? What limitations?
I think we have to move slow. If you move too fast and you just put a big old rainbow out there and just start all of a sudden advertising things loud, I think you could shoot yourself in the foot. You could bring in the LGBTQ plus community, but yet your staff wouldn't be trained, your staff wouldn't be welcoming, your staff wouldn't be inclusive. And if you do that, the LGBTQI plus community would say that's not a safe place. Don't go to Northeast Georgia Medical System. So I think it does need to be a slow increment, a slow process to make sure we get it right.
Thank you for that. There are no further questions.
I'm gonna add something, and this is me. This is from my perspective as a person who's been in a lot of environments, from being part of a pretty for my school at the time, a big gay straight alliance. We did a lot of things, and I just remember the backlash was almost counterproductive to the conversation. And so doing things with intentionality is so important. Having those important conversations and meaningful conversations with our colleagues who are encapsulating some views that are certainly prevalent through our community, and advancing the conversation that way. And it's tricky. It's hard. I'm here as a leader in psychiatry, and yes, we're here. We're going to say these things. We're going to be present. We're going to be available. I'd love to see, a lot more representation on the billboards as I come to work. That's meaningful change for me. But I also want to make sure it's sustainable change, and that's the tricky part. I remember they removed our funding because we were a little, young and progressive, and we moved things a little too fast, and we almost lost our funding. And so it's tricky. And I hate that it's tricky because these things make so much sense to me, these conversations and everything. But for some people, it's harder. So you have to have a long, difficult conversation, and that's okay. Let's have the conversations. Let's start the education. Let's wear a rainbow around campus and do those things. And then, be open if you want to be open about who you are and what your beliefs are. And that takes a lot of bravery. That's that simple thing done well. And so, and for you to be so brave to bring this to the fore in a place where, to be frank, I was coming in here, I was a little surprised we had even a transgender clinic in Gainesville, Georgia. I think these are brave things, and I want to recognize that. And for every person who does that little brave thing, those matter so much, and they advance change. And that's where I come from, and it's meaningful. And I don't know what the right answer is. I'd love to have a lot of rainbows running around Gainesville, but I don't think that's gonna happen. And I think it's gonna have a lot of backlash. Even if I look at something like drag shows and things, that I don't have, but it's such a contentious issue, and it's led to a lot of safety concerns in a lot of different communities. So it's a difficult conversation, and we should have it amongst ourselves and with a safe community, but we should also, how do we bridge those conversations and gaps to create more understanding? And that's hard. It really is. And I don't know if there's a great answer to that. So, but that's me. That's not in the organizational stuff.
Thank you for sharing that. I also want to thank the people who are online who gave those thoughtful questions. I do appreciate it. So I have one last question, is to Dr. Bahnmiller. Earlier, I asked, what inspired you to start this gender affirming care series? So as we continue to care for our LGBTQ plus patients, what does success look like in terms of impact and outcomes you're hoping to achieve?
Success to me with our transgender population is not only me treating the gender incongruence or gender dysphoria, but being able to send my patient to a specialist, knowing they're safe at the specialist. I don't care which specialist it is. I would like to see all of us provide care to the LGBTQIA plus community. That is my goal, and that's what I want to see. A safe space where patients can get inclusive, affirming care, so we don't have somebody who is a transgender person, never went to the doctor because they're afraid to go to the doctor, and they have a heart attack in their 40s. We could have prevented that if they just would have came in to see us. We could have prevented that, but I would love to be able to send my patients any place within our health system, knowing that they'll be safe. That would be success to me.
Thank you. And it really is in alignment with our mission of improving the health of our community, everyone that's a part of it. So I just want to thank everyone that's in the audience and online for this. And then once again, if you have not caught any of our series, you too can join our NGHS CME YouTube channel where you can hear the other presentations in its totality. Have a great afternoon.